Good afternoon and a very warm welcome to everyone for joining today's meeting, a comprehensive EU framework on respiratory infection prevention, closing the immunisation gaps. A warm welcome to those of you who are in the room, but we have a number of people who are joining online and you are also equally welcome. My name is Nicola Bedlington and it is my pleasure and honour to moderate this year's EU Respi Day event. This event is organised by the Steering Group on the Prevention of Respiratory Infections. And the Steering Group is essentially an EU coalition, active since 2017, that really is multi-stakeholder, bringing together different health stakeholders to advocate for broader immunisation efforts, stronger EU health policies, and increased awareness around the prevention of respiratory infections. This year marks an important milestone for the Steering Group as it broadens its focus and its remit beyond influenza to include other major respiratory infections. And to mark this transition, the Steering Group is launching today its new manifesto on strengthening EU action on respiratory infection prevention through immunisation. Every October, the Steering Group leads awareness campaigns, which includes today's event in the framework of the EU Respi Day, and this was previously known as the EU Flu Day. Our event today is hosted by MEP Billy Keller and of the Liberal Renew Group from Ireland, and actually we feature Ireland as a case study for prevention, given its strong public health record and EU leadership in immunisation. And also, of course, in the light of the forthcoming EU presidency in Ireland in 2026. We're very grateful to Mr. Keller and his great team for hosting and supporting this event. And it's also a real pleasure to acknowledge the Steering Group co-chairs who we have here, Mr. Stephen Donnelly, MEP Dolores Montserrat and Professor Colin Russell, who continue to lead, guide and inspire the Coalition's efforts. Throughout today's discussion, we will hear from policymakers, patient representatives, people with lived experience, scientists and advocates who share their diverse perspectives on how the EU can strengthen its framework for respiratory infection prevention. And to kick us off, I'm delighted to invite MEP Dolores Montserrat, co-chair of the Steering Group, to open this event and say a few words of welcome. Please, Dolores, the floor is yours.
Thank you so much, and thank you to the MEP Billy Keller to host this important meeting. Good afternoon to all of you, and thank you all for joining us on this European Union Respi Day, an important annual moment to reflect on the critical importance of immunisation for preventing respiratory infections. I would like to start by thanking our speakers. I'm sure your contribution will lead to engaging and insightful discussions. And as a co-chair of the Steering Group on Prevention of Respiratory Infections, formerly the Steering Group on Influenza Vaccination, I'm proud to have helped guide this work for many years here in the Parliament. The expanded scope of our group reflects a simple but urgent truth. We need stronger protection, not just against seasonal influenza, but also against COVID-19, respiratory syncytial virus, and pneumococcal disease. Today, it's a milestone. The Steering Group launched its new manifesto calling for an updated European Union framework for respiratory infection prevention. I'm pleased to endorse the Steering Group's call for a Council recommendation on the value of immunisation against respiratory infections as a foundation for this work. The growing attention towards this annual event and campaign is a promising step in the right direction. However, we need to continue to work towards closing immunisation gaps in coverage against respiratory infections. As we will hear today, respiratory infections are among the most common infectious disease in Europe and pose a significant public health threat in Europe to all our public national systems. Yet many of their most serious consequences are preventable. This is why the European Union's target of 75% flu vaccination for at-risk groups is more relevant than ever and should be expanded to include other respiratory infections. The importance of vaccination against respiratory infections is especially true for vulnerable population, including those with conditions such as cardiovascular disease, as vaccination has proven to reduce the risk of major cardiovascular events. That's why we must support resilient and sustainable health system and robust vaccination programs all around Europe. We can make progress in boosting immunization for respiratory infections. For example, in 2023, Spain rolled out a pioneering respiratory syncytial virus immunization programs for all infants. The results were remarkable. In total, approximately 90% of eligible infants were immunized. Meanwhile, infant hospitalization rates dropped from 10.3 to 174 per 1,000 infants. Progress can be made. All we need are the right policies and the political will to put them in place. Spain's example shows what can be achieved with action to prevent respiratory infections. It is time for renewed European Union policy action to promote immunization against this disease. While the 29 Council recommendation on seasonal influenza vaccination provides a strong foundation for European action, further progress is needed to match the scale of today's challenge and address the reality of other respiratory infections. A comprehensive European Union approach will not only save lives, but help boost European Union competitiveness and resilience. For these reasons, I joined the steering group in calling for a new Council recommendation on the value of immunization against respiratory infections, expanding the scope beyond flu to also encompass other respiratory infections like COVID-19, RSV, and pneumococcal disease. Now is the time for the European Union take the action to protect the health of its citizens against respiratory infections. So, I want just to conclude to thank all once again for being here today. I look forward to hearing your contributions and engaging in what I'm sure will be a lively and insightful discussion today. And I'm now pleased to hand over to the fellow member of the European Parliament, who is hosting the European Respiratory Day even today. So I'm giving the floor to my colleague, Billy Keller, and thank you again to you to host this important meeting for us today. Thank you.
Grazie, Dolores. Thank you very much. A lot of Irish people go to Spain for nice dry weather and air. So that's when we have the flu, we get on the plane and we go to the south of Spain for nice recuperation. Thanks very much, Dolores. First and foremost, look, I'm delighted to extend a very warm welcome to you all, both those here in the room and those online as well. And it's my pleasure to host this EU Respiratory Day, which was previously the Flu Vaccine Day. The Flu Vaccine Day. And, the purpose of this really is just to promote the concept of immunisation and vaccination as a public health policy measure. We had previous discussions earlier today at another forum in the same room, and it is clear the evidence is overwhelming about the need for us to continue to promote immunisation and vaccination programmes. From a European perspective, we are doing well, but we must do an awful lot better. And as time goes on in technologies and medical advances, we will have more vaccines available to us. But equally, we also have to be conscious of the fact that some people and some groupings try to undermine public health policy through misinformation and disinformation underpinning the issue of vaccines. So from my perspective, look, I would be calling on the Council, the steering group calling on the Council's recommendations on the value of immunisation against respiratory infections as a foundation of this work. Respiratory infections are some of Europe's most serious public health threats. And as we've already heard from the lowers, diseases including influenza, COVID-19, RSV and pneumococcal disease are a leading cause of comorbidities, hospitalisations and deaths. So if we were to look at it through two prisms, the first, the impact that immunisation has on the individual, the fact it saves them from very serious illnesses, and then couple that with the cost of hospitalisations. And if you look across the European Union, most of our health services are under significant challenge financially in terms of trying to deliver acute care and emergency care. And certainly anything that can reduce overnights and bed nights is something that's critically important so that we can continue to front load spending elsewhere. The difficulty, of course, always is that when budgets are under pressure, you are going for the immediate wins, and prevention very often takes a secondary position. And that's something that the Council, I think, should really reinforce in making recommendations to Member States, that they would try and front load prevention as well, as it's being seen to be an afterthought because of the pressures on budgets of a lot of Member States. Today's conversation is as timely as ever. We must continue to push to close immunisation gaps to ensure that all citizens are protected against these health threats. Indeed, the EU has a clear opportunity and responsibility to lead on preparedness by strengthening investment in public health prevention, especially as other major players retreat from sustained public health investment. I'm proud of Ireland as one of Europe's leaders in immunisation, and I'm also very proud of the fact that Stephen Donnelly is sitting here next to me, a former party, still a party colleague, but a former Minister for Health in Ireland, and he led Ireland through the COVID pandemic. And really led from the front in the COVID pandemic. And I think that we were exceptionally fortunate to have Stephen as the Minister for Health at the time. It was challenging, but led from the front, and we did have a huge uptake and a huge programme in terms of immunisation and vaccines when they became available. They were rolled out very, very quickly. So I do want to acknowledge your role in saving many Irish lives and making sure that our health services weren't overwhelmed. This leadership position has been established through a combination of high vaccine uptake, evidence-driven decision-making and early adoption of preventative measures. Ireland has long been a champion of respiratory health. In 2004, we became the first country in the world to ban indoor smoking in the workplace, paving the way for similar policies across the entire European Union. Our focus on preventative health and sustained public health investment means that we've been able to make significant progress in tackling the burden of respiratory infections. For example, Ireland has consistently met the World Health Organization's 75% influenza vaccine target for older adults in the last 3 winter seasons. At the same time, amid rising global vaccine hesitancy, Ireland's public confidence in vaccines remains high, with general perceptions of vaccine safety among Irish people increasing between 2018 and 2022. Yes, there is progress to be made both in Ireland and in the European Union. And for this reason, I joined the steering group in calling for a new and more comprehensive EU framework for respiratory infection prevention. As you will hear throughout this afternoon's event, while influenza has long been a challenge for the EU, EU-level guidance and policy frameworks, we must work towards building an EU framework that incorporates other respiratory illnesses and threats as well, including COVID-19, RSV and pneumococcal disease. The flu blueprint can show us the way forward. Harmonised coverage targets at EU and global level, coordinated immunisation strategies, integrated surveillance and data collection can help us make real strides. Meanwhile, sustained investment in immunisation and addressing vaccine misinformation remain critical. And I keep emphasising this is critical because it is not just misinformation, but it is also done for political purposes in some member states to undermine public confidence in public health. So look, I want to wish you well, and I hope that after today there will be further confidence in immunisation as a public health measure, and also that the Council will play its part in making sure there's recommendations to member states around the rollout of immunisation programmes across the EU. Thank you very much.
Thank you very much indeed. This whole notion of front-loading prevention, I think, is an absolutely critical message. Warmest thanks to both MEP Montserrat and indeed MEP Keller for being such beacons of support for more progressive policy and implementation in the space of prevention of Respiratory Infections. It's now my great pleasure to welcome Professor Colin Russell, co-chair of the steering group from the University of Amsterdam and board chair of the European Scientific Working Group on Influenza and Other Respiratory Viruses. You will, I understand, introduce the manifesto call for action and indeed evidence, but also outline a few strategic priorities of the steering group moving forward. The floor is yours.
Good afternoon, everyone, and thank you all for being here today. As the co-chair of the steering group on Prevention of Respiratory Infections, it is a pleasure to welcome you to our event as part of EU Respi Day. Let me start with a quick word about who we are. The steering group on Prevention of Respiratory Infections is an EU-level coalition bringing together members of the European Parliament, patient organizations, healthcare professionals, academia, and international NGOs. Together, we advocate for stronger immunization efforts across the EU, raising awareness and driving policy action on respiratory infections. Earlier this year, our group evolved from focusing solely on influenza to addressing other respiratory infections like RSV, pneumococcal disease, and COVID-19. Why? Well, because the evidence is clear. The burden of these infections goes far beyond any single disease. Respiratory infections are among the most common infectious diseases in Europe, and they continue to place enormous pressure on our health systems. They don't just affect one group. They hit older adults, young children, pregnant people, and anyone living with chronic conditions like cardiovascular disease or chronic respiratory diseases. Individually, each of these infections poses a major public health risk, but together, their cumulative impact is even more concerning. It's a constant and evolving threat that undermines population health, strains hospital capacity, and weakens preparedness. Across Europe, we are having important conversations about preparedness, about defense, about autonomy, and about resilience. But this is not only built on borders and technology. It's also sustained through protection of our people, through our health systems, and preventing infections that weaken our people. That's why our message today is clear. We need a new Council recommendation on the value of immunization against respiratory infections. Despite the existence of safe and effective respiratory infection immunization methods, coverage across Europe remains too low. In some countries, this can be as low as 10%. At the same time, we are facing rising health threats and mounting pressure on health systems. But there is also an opportunity in all of this. As other global actors, like the United States, scale back their long-term health investments, Europe has the opportunity to lead by example. In these challenging times, Europe can champion prevention as the foundation of sustainable resilience, showing that protecting health strategies strengthens economies. Immunization is a proven and cost-effective tool that saves lives. Adult immunization programs alone can return up to 19 times their initial investment. We already have a strong foundation in the 2009 Council recommendations on seasonal influenza vaccination. But today, meeting these challenges requires that we cover other respiratory infections, some of them with pandemic potential, and so we simply must go further. That's why our steering group is calling for a new Council recommendation on the immunization, for the immunization against other respiratory viruses in addition to flu. This recommendation should call on member states to invest in immunization. How? Well, by using the flexibilities of the new economic governance framework and by funding initiatives for education, training, and best practice exchange amongst healthcare professionals. It should also call for the implementation of an EU-wide annual coverage target for not only influenza, but also for COVID-19, RSV, and pneumococcal disease, building on the 75% benchmark for at-risk groups. Member states must also work to strengthen surveillance and data collection by expanding existing influenza systems to cover all major respiratory infections. As we face a rise in misinformation that has eroded public trust and slowed vaccination uptake, member states must address it head-on and rebuild vaccine confidence. This requires transparent, evidence-based communication and community engagement. This new Council recommendation should invite the European Commission to commit dedicated EU funding for immunization, helping to expand access, accelerate innovation, and support vaccine confidence, for instance, by reinstating the Vaccine Confidence Project. As part of this, the Commission should also embed immunization education into medical training and everyday practice so that healthcare professionals can lead by example. Immunization must be included in wider EU health and resilience strategies, and this includes the upcoming cardiovascular health plan. The evidence is clear. Immunization against flu, COVID-19, RSV, and pneumococcal disease has been shown to lower the risk of myocardial infarction, stroke, and heart failure by mitigating systemic inflammation and preventing infections that strain the cardiovascular system. People are 6 times more likely to suffer a heart attack if diagnosed with flu, even when they have not been previously diagnosed with cardiovascular disease. However, there can be a 33% reduction in cardiovascular deaths when cardiovascular patients are vaccinated against flu. As such, we advocate for the plan to include a flagship initiative on the role and value of immunization in cardiovascular health, reflecting the growing body of scientific evidence. Finally, fragmented data collection and delayed reporting is a challenge when it comes to timely public health responses. The Commission must also support the ECDC with harmonized guidelines for reporting immunization coverage data and invest in digital infrastructure so that immunization coverage rates become a recognized performance indicator. In short, we have the knowledge, the tools, and the precedent. What we need now is the political will to act. A new Council recommendation on respiratory infection immunization would send a clear signal that Europe is ready to lead, protecting its citizens, strengthening resilience, and investing in a safer future for us all. Thank you very much.
Thank you very much, Colin. I mean, the statistics are really shocking. 10% of uptake immunisation in some countries. And you've touched on so many different topics. Big message is that prevention is really linked to resilience and really linked to thriving societies, which we're all aspiring to as well. Thank you very much for that. We're now going to shift gear and hear from the European Commission, and I'm delighted to welcome Rita Figueira, who is a policy officer from DG Santé, the directorate within the European Commission responsible for health and food safety. And your work focuses primarily on health security. Rita, thank you so much for joining us today. It's a real pleasure to have you here. The floor is yours.
Thank you very much. I'd like to start just by thanking the organizers for the invitation to speak today. So, vaccination. It's undoubtedly a major public health success and one of the best disease prevention tools that we have. However, we know that we must continue our efforts to promote it, as we are simply not meeting all of our vaccination targets in the EU. And why is that? Well, could we say that vaccination is a victim of its own success? Maybe because we don't fear what we no longer see, or some people talk about fatigue after COVID. Or can we blame information overload with mis and disinformation rife on our social media platforms? The message about vaccination, which is probably so clear to all of us here in this room, which is that vaccines are safe and they save lives. Well, that message is unfortunately not reaching the general population as we'd wish. But can it also be missed opportunities? How do we facilitate vaccination for those who do want to be vaccinated, but have busy lives with conflicting demands between work and family? For those people, perhaps finding a suitable time in a suitable place to get that important shot is not as easy as it sounds. So the situation is clearly influenced by a multitude of factors, which DG Santé is interested in exploring and for which we have funded many projects under our EU for Health and Horizon Europe programs in the last few years. So our main objective is to support the member states in their national measures, recognizing that the first responsibility on the ground rests with national and regional health systems. We have placed a big focus lately on identifying barriers and facilitators of vaccination. So let me give you just a few concrete examples. We have piloted initiatives in several member states to address practical and administrative barriers to vaccination, such as reminder schemes or mobile vaccination units. We're also supporting actions, some of them with WHO, that focus on health inequalities and reaching out to underserved communities. We have also initiated several interventions to reduce vaccine hesitancy and with an important focus on healthcare workers. So all of these actions, plus many others that I cannot mention now, serve to bring about EU collaboration on vaccination and promote best practices with the ultimate aim to increase vaccination coverage. So Professor Russell just mentioned now the 2009 Council recommendation on seasonal flu vaccination that establishes a 75% target for influenza in at-risk populations. Well, since then, we've also had to deal with a new respiratory virus, SARS-CoV-2. A new vaccine has been developed for RSV, and more emphasis is being placed now on vaccination of older adults against pneumococcal disease. So it is indeed a changing landscape, and we must double our efforts to tackle these diseases through immunization. DG Santé takes a life course approach in its work on immunization, because vaccines can be the best prevention at many stages of a person's life and not just in childhood. And immunization of adults is particularly important with respiratory diseases, and the evidence is indeed clear that there is a very strong socioeconomic value in investing in adult immunization programs. So DG Santé continues to work with the member states to facilitate their work on assessing vaccines and their decision-making on national programs. For instance, the European Centre for Disease Prevention and Control, the ECDC, manages the EU-EEA NITAC collaboration. So this is a network for collaboration between national experts, allowing for the exchange of, and joint collation of science-based evidence of vaccines. And DG Santé supports this network with 2 million euros to generate systematic reviews and capacity building. In addition, DG Santé and ECDC support guidance and training on vaccination for healthcare professionals. Health workers have a fundamental role in vaccination, as their own attitudes towards vaccination affect those of the patients. They are a trusted source when it comes to communication around vaccines. The Coalition for Vaccination, which was established by DG Santé, brings together European associations of healthcare professionals to promote trust in vaccines. And this is very important because we continue to fight an epidemic of mis and disinformation. And so to counteract this, DG Santé provides reliable and science-based information through platforms like our European Vaccination Information Portal or campaigns like United in Protection. We also work closely with the CDC and the European Medicines Agency to increase transparency around the authorization of vaccines and their monitoring once they are on the EU market. So, as we've heard today, respiratory infections in the EU are the cause of many lives lost every year. And they will represent a large burden to our health systems, and they're equally damaging to our economy in loss of productivity. And on top of that, respiratory viruses also have the potential to cause immeasurable disruption, as they are the most likely cause of a future pandemic. And we've all experienced this recently with SARS-CoV-2. So this is why DG Santé has taken steps to strengthen the EU's capacity for surveillance of communicable diseases through the regulation on serious cross-border threats to health that was adopted at the end of 2022. So as a part of a legal framework to coordinate robust preparedness and response mechanisms for health crises, the Commission was empowered to set up EU reference laboratories for public health. So their role is to support national labs by offering technical guidance and coordinating quality assurance activities, and helping strengthen lab capacity. So they will improve disease surveillance by ensuring that laboratory data from different countries is more consistent and aligned. And I'm happy to announce that the Commission, through DG Santé, is planning to designate a new EU reference laboratory for respiratory viruses before the end of this year. And this regulation that I was just mentioning also sets new requirements for national competent authorities to report more comparable and compatible surveillance data. Furthermore, it tasks the ECDC with the development and operation of improved integrated surveillance systems. So together, DG Santé and ECDC continue to help the member states with the digitalization of their national surveillance systems. And this year alone, the Commission contributed over 80 million euros in direct grants to the member states to strengthen their national surveillance systems. So the objective is to achieve earlier detection of threats via the exchange of standardized and high-quality data to allow a rapid response to any cross-border health threats. And this includes, of course, respiratory diseases. So 2 years ago, ECDC and WHO Euro jointly launched ERVIS, which is an interactive surveillance data dashboard for influenza, RSV, and SARS-CoV-2. This taps into sentinel surveillance systems in healthcare settings, and this platform will facilitate the early detection and communication of signals of respiratory virus circulation in the EU, as well as in the broader WHO European area. But another important area of reporting, which we must mention today, of course, concerns immunization coverage data and working with the member states towards common guidelines for better data collection. So developing digital health infrastructures across the EU is key, as is the integration of immunization information systems together with electronic health records. So only those types of advances can enable us to identify and monitor all of the at-risk populations, as well as to link prevention services with interventions and then the resulting health outcomes. So finally, I would like to also mention the work that DG Santé is doing to develop an EU cardiovascular health plan. So, of course, this is naturally of interest to the steering group, as you just heard, given the strong link between respiratory infections and cardiovascular health, as we just heard, of course. So infections like influenza can indeed increase substantially the risk of heart attacks, for example, especially in people that already have cardiovascular disease. And vaccination is, of course, the best preventive measure against infection-related complications in high-risk groups. Yet immunization remains an underutilized public health strategy for people who are already suffering from pre-existing conditions of the heart. So for this new cardiovascular health plan, DG Santé will draw on the Europe's Beating Cancer Plan by taking a comprehensive approach. So from prevention to early detection and screening, to treatment and management and rehabilitation. So in this new plan, we can expect an acknowledgement of the close link between respiratory diseases and cardiovascular health. And so I invite you all to watch this space closely. And meanwhile, I'd just like to mention that the first action, joint action, on chronic respiratory diseases, which is called JARET, has started its work in January of this year and is supported by 5 million euros from our EU4Health program. And one of the aims of this joint action is actually to facilitate relevant vaccination programs. So I would like to just conclude my intervention to, again, thank today's organizers for raising such important questions in the field of vaccination against respiratory diseases. And DG Santé, of course, recognizes the public health impact of respiratory diseases and will continue to support national efforts towards closing immunization gaps in the EU. Thank you.
Thank you very much, Rita, for that really comprehensive overview of the landscape, the changing landscape, but the commitment of the Commission in many different areas. You touched on so many topics, the new cardiovascular health plan, of course, but also the deep collaboration that's happening with other institutions, the European Medicines Agency, ECDC, WHO, the collaborative work with member states to move the needle. And I think a lot of what you have said, excitingly, is also echoed in the manifesto. I think we're all going broadly in the same direction, which is really good news. And on that topic, we're now going to home in on Ireland. Sorry, excuse me. We are going to home in on Ireland and the sterling work that's happening there on prevention. And it's an honour to welcome Stephen Donnelly, former Irish Minister for Health and currently a partner in CF, which is a health consultancy, to share some learnings about what has happened in Ireland. We heard about your fantastic work during your tenure as Health Minister, so hearing a little bit about that will be fantastic, but also thoughts about the wider EU policy environment as well. The floor is yours.
Thank you very much, and good afternoon, everybody. I'm delighted to be here to talk about how we can increase the uptake of respiratory vaccines right across Europe. I'd like to thank my party colleague, Billy Kelleher, MEP, for hosting us here today, and the steering group for their work, not just in organising today, but for the ongoing, incredibly important work that they're doing behind the scenes all the time. Specifically on today, can I just give a quick nod and thank you to Katrina, to Nicola, to Valentina, to Elisa, and to Mark for everything that you've done. And indeed, can I acknowledge my fellow speakers as well? And if the others don't mind, can I particularly acknowledge Rachel for the testimony that she will be providing, which is really speaks to the entire point of what all of us try and do in terms of this work. I was Ireland's Minister for Health from 2020 until earlier this year. And for obvious reasons, I started when COVID was beginning to spread across Ireland. So for obvious reasons, I had a lot to do with vaccines and with preventative healthcare over the 5 years. I led the vaccine rollout, the COVID vaccine rollout in Ireland. I also authorised the RSV vaccine for infants to be rolled out from the winter that has gone by, and I'll come back to that in a while. I expanded the HPV vaccine. I know we're talking about respiratory vaccines today, but it was another. It's another hugely important vaccine, a program launched by Mary Harney, who was speaking here earlier on. And then I've been working very closely with our clinical community to continue to try to strengthen the uptake of the flu vaccine every winter from the general public, and then obviously from our healthcare workers as well. I was thinking about what I'd say here today. I'm not a clinician and I'm not a scientist, and people like Dr. Russell and others are far more qualified to talk about the science. And I was reflecting that it's fitting that we're having this meeting in the European Parliament, because unlike most parts of medicine, vaccines are intensely political. I had COVID vaccine protests outside my family home. I had protesters outside my family home, no more than a few meters from where my children were, calling publicly for my children to be taken off me. The threat level escalated to the point where I had to have a police protection detail. And the personal media and online attacks were sustained and pretty intense. And what I've just described was completely normal for my colleagues right across Europe, those who are involved, be they ministers for health or chief medical officers or whoever it might be. These kind of experiences are intensely political, can be very worrying at a system level, and unfortunately were common right across Europe, and indeed we saw it in the United States and other places as well. And all of this was in response to a vaccine that was doing two things. It was clearly saving lives in Ireland and everywhere else every single day. And it was stopping our entire health service from being overwhelmed and not able to provide all the other non-COVID care. And in spite of this extraordinary medical tool that we had available to us, there are very few things that brought people out onto the streets in protest as much as this did. And so what effect did it have? There was a paper published late last year in the European Journal of Public Health, and for Ireland it found that the COVID vaccine averted about 100,000 hospitalizations, averted about 3,000 ICU admissions, and saved about 16,000 lives. There's very few things that governments in Ireland do in any given decade that you can directly point to and say that has saved tens of thousands of lives, and yet there was an intense political reaction to it, which I think is very interesting. So, what are the challenges if we are to succeed, as we must, in increasing the take-up of vaccines, respiratory vaccines, and others? We need to understand the challenges, and we need to support our clinical community, the politicians, civil society, and the public in facing those challenges, and where possible turning them to our advantage. Some of the challenges are relatively straightforward. Policymakers need to identify the right vaccines, they need to target them to the right people, and they need to figure out how to physically get them out to the right people. Now, that's not an easy thing to do, but it is entirely solvable. There's lots of clever people in every country who are capable of doing these things. Secondly, governments and industry have to negotiate price and volume that works for both sides. Again, it's a complex process. It can become very fraught, but it's a relatively straightforward thing to do. Both parties need to get together. They need to agree a price. The other challenges, though, really are much more complex, and I think there's been a lot of really insightful discussion on it in both this session and the previous session. And the one I want to talk to is public trust. The need for a coalition of politicians, scientists, clinicians, patient advocates, civil society to work together to listen very carefully and to try and help build and sustain public trust in vaccines. Now, in Ireland, we most certainly did not and do not get it all right, but we are in a reasonably good position in terms of the uptake in vaccines. So some of the things that we do that I believe help. The first is that we lead with the experts. People like me tended not to talk about the benefits of vaccines. We asked doctors and scientists and nurses, chief medical officer and others to go out and talk about the vaccines. And people like me who have no clinical or scientific training did our very best to stay quiet, which is not an easy thing for politicians to do. And we try to listen carefully because people have real concerns, and it doesn't always go perfectly. And there can be adverse reactions, and we have to be very respectful and very humble and listen very carefully to what people's concerns are so that we can then try our best to address those concerns. The second thing in Ireland is there is generally cross-party support for the science of vaccines. The opposition, or indeed during COVID, one or two people in Billy and my party who were in government did their best to undermine the rollout of the vaccines. But I don't recall anyone in Parliament challenging the science. Broadly, people said, you're a terrible government, you're a terrible Minister for Health, but we think we accept the science, and we think people should take the vaccines. And actually, that's really important. It's really important for the public to see that in spite of all our differences, Parliament stood united on the science. The third thing is, I would say the same for the media. So for mainstream media, now again, there were elements of the mainstream media that made concerted efforts to undermine the rollout of the vaccines and the government's rollout, but I don't recall mainstream media attacking the science. It was taken as a given that the vaccines were the right, that taking the vaccine was the right thing to do, and that the numbers being presented by the clinicians and the scientists were correct. And again, it was a very important message and symbol to the public that said, well, Parliament is united on the science. There aren't really serious dissenting voices in mainstream media on the science. We'll come to social media later, and I think that mattered. The fourth thing that we try to do is to make it as easy as possible for people to get the vaccines. I'm a great believer when you're trying to implement public policy in making it easy for people. Even the slightest complications turn people off and they say, we're not going to bother. One very large change I made in Ireland is, up to COVID, we didn't really use the pharmacists for vaccines. And the strong advice I was getting as minister was, don't stick with the program we have. And I decided to widen it to the pharmacists, and it worked. And the concerns that were held didn't materialise, and the pharmacists did an extraordinary job, and GPs did an extraordinary job. So one of the things we've tried to do is expand the distribution network. There are pharmacists in every town, most towns and villages in Ireland, and so we just made it easy for people and free. If you're in a target group, the vaccine is free, and I think that made a big difference. And the final thing is, I'd say we've been incredibly lucky with patient advocates. And I'll just reference one, is the late Laura Brennan, who tragically died of cervical cancer at just 26 years of age. But when foreign misinformation and lies came to Ireland on the HPV vaccine, and those lies, without any doubt, will have cost lives, the lives of women and probably men in Ireland. There was a concerted effort by the Irish public health authorities, civil society, and some of that was fronted by this extraordinary woman called Laura Brennan, who just managed to connect with people. And Ireland is one of the few countries that managed to reverse the decline in the uptake of the HPV vaccine. And I'm delighted to say that we're on track. Please God, it'll continue. We're on track to be one of the first countries to look at full elimination of cervical cancer. So we've been lucky. So what have the results been like? I was looking at Wikipedia on Ireland's COVID vaccine rollout. It was very positive, so I decided I'd use it. And I quote, "Ireland's COVID vaccine rollout has been praised as one of the most successful in the world and was ranked #1 in the EU in terms of adult population fully vaccinated and booster vaccines administered. Our flu vaccine uptake is staying above the EU target of over 75% for the over 65s. And last winter's RSV vaccine had a 94% hospital avoidance for infants. It was absolutely extraordinary. I authorised it last year. I bypassed some of our processes, which can take a little bit of time, on the back of the Spanish data, which was extraordinary. But even when we pushed it through, I was not expecting a 94% reduction in infant hospitalizations with respiratory infection. Absolutely extraordinary. Because certainly in Ireland, for probably 4 to 6 weeks of the winter, our paediatric acute services, surgical services, kind of grind to a halt because our ICUs are full of infants with RSV. So the effect it has both for those children and their families, but also for all the children who can now be operated on because the ICU isn't full of very sick babies with RSV. It's been absolutely extraordinary.
Stephen, could I ask you to stand up a little bit?
I will. I certainly will. Apologies.
Absolutely fascinating.
It's the problem with asking ex-politicians to
It's
talk.
fascinating, but we have a few other interventions as well. Thank you for that.
Not at all. Not at all. Well, look, maybe in the panel I can come back to some of the things that I would suggest, but I'll just finish by saying I've taken a look at the steering group's call for the council recommendation. I think it's eminently sensible. So well done. Thank you.
Well done, Stephen. Thank you.
Thank you very much, Stephen. You've really painted an extremely clear picture of some of the opportunities, challenges and real successes in Ireland that will be sustained, of course. I mean, some of the fundamentals around cross-party support of the science is really important. That unity that you described, listening deeply to people, their concerns, but also what their unmet needs really were. And also from a personal perspective, you highlighting the role of patient advocates and the patient community themselves as an important voice in this debate, really, really important. And on that note, we're going to come to our final contribution before the panel discussion, and an absolutely crucial one. Rachel Thomas, it's a wonderful opportunity to welcome you today. You're part of the RSV patient network of the International RSV Research Consortium, and we're really delighted to welcome you today to talk a little bit about your experience, your lived experience. Please, the floor is yours.
Thank you very much, and thank you for inviting me. Hello. I'm here today as a mother, a sister, and an aunt to give you just a glimpse of what RSV has meant for my family. In the UK, we are fortunate to have accessible hospitals and medical care which are free at the point of use. Yet nearly 16 years ago, I experienced the heartbreaking reality that these facilities are not always enough. When my 13-week-old son, Alexander, contracted RSV and died. Alexander was my third of 4 boys and was born a happy, healthy baby. The week of his death, he had mild cold-like symptoms, but remained alert, albeit a little grumpy. The day before his death, I took him to the doctor with concern about his cough and colour, but was reassured he'd be fine and may have a little bit of bronchiolitis. That evening, everything changed. Alexander woke up screaming in a way I will never forget. He was struggling to breathe, and an ambulance was called. At the hospital, Alexander arrested, and for 2.5 hours, doctors and their teams fought to keep him alive. But he was too small and the virus was too big. Around 2 a.m, on the 5th of February 2010, Alexander lost his battle. Sorry. He died in my arms, and I sang to him like I did every night before bed, so that he had my voice and hopefully that he wouldn't be scared. Unfortunately, our story does not end there. In 2023, my nephew Tobias also became critically ill with RSV at 7 months of age. He was unconscious, barely breathing, and placed on life support machines fighting for his life. Thanks to the medical teams, Tobias survived. Today, he is a noisy 2-year-old, but he still needs specialist care for ongoing problems that doctors link back to his close encounter with RSV. Ours is just one story amongst many across the world. So today, I want to take a moment to ask you to reflect and recognise that a virus like RSV can cause serious implications on both the young and the old that go far beyond the lungs. Many families, like mine, live with the emotional and physical aftermath of an RSV infection for years. Some are left dealing with developmental delays, ongoing medical needs, chronic conditions such as asthma, recurring infections, and the grief of watching their child struggle, or in the worst cases, not survive. I am here today to give those families a voice and a face, and to remind us all that the broader impact of RSV is not just medical. It's deeply personal and long-lasting. Preventative measures such as hand washing or keeping ill people away from babies or older relatives are sometimes not enough to stop RSV. Factors such as going to work, having a family, attending school or nursery all increase exposure. I have spoken to parents who've had to stop working or cannot take their child to a simple birthday party as they do not want to immerse their child into potentially high-risk environments. This has huge implications both financially and emotionally. This is where immunisations can play an important role in the fight against RSV, where ultimately prevention is better than any treatment that can currently be offered. However, I know as a parent that new immunisations can bring anxieties leading to low uptake. The 3 new options are an amazing step forward. But for them to work, families must trust them, putting their faith and their children's lives in the hands of people they do not know and research they may not fully understand. This means everyone should know what RSV is and what can be done about it. Yet here we are in 2025, nearly 16 years on from my own son's death, and I argue that many still have no concept of RSV, even though its strength is undeniably devastating. As I said to the audience at the ResVinet Global RSV Conference in February 2024, how do we expect immunisation programmes to work if people do not understand what they are being protected against? Beyond being a mother, I am a university lecturer, so it will come as no surprise that I strongly believe that education is the answer to help combat some of the fears and anxieties that may occur with new immunisation programmes. As part of the ResVinet journey in achieving greater knowledge and understanding, the new RSV chatbot was launched in 2024 on World Pneumonia Day. The chatbot delivers up-to-date information and is an interactive tool that is easily accessible, hopefully making it more likely for patients, parents and families to engage with it. For the public to feel empowered by their decision to have an RSV vaccine, they need to be educated, and the chatbot is a positive step forwards. However, I argue that health professionals play a key role and need to feel confident in the passing down of information to those that they treat and support. It is essential for healthcare professionals to build a foundation of trust and engage in open and honest conversations with parents, carers, and the older generations about RSV, the available vaccines and how they work, enabling meaningful dialogue where individuals feel heard, their concerns addressed, and informed decision-making is supported. RSV is now a preventable illness, thanks to the vaccinations and preventative measures that have been developed. But this brings mixed emotions for me. I am, of course, ecstatic that the lives of the young and the old can now be saved, and that families will be spared the loss and trauma my own family has experienced. However, I am also deeply saddened that these advancements didn't come in time to save so many others, including my son. I can only dream of what it might have been like to celebrate his 16th birthday in 3 weeks' time. But instead, I am left wondering who he might have become. There are further, wider impacts that illnesses like RSV can cause, such as the impact on siblings. Alexander's eldest brother, Oliver, is now 20, and he has a few vivid memories of Alexander. One in particular he talks about, where a then 4-year-old Oliver was messing around at the dinner table and Alexander laughed at him. The lifelong impact on my other children are described with such feeling through Oliver. He will openly talk about the sibling guilt he has and how everything he does in life is so that if his brother were here, he could look up to him and be proud. He says that every time he goes to the grave, he feels the grief of him passing away as if it happened a week ago. He feels this is something that will never change. In every card that Oliver writes, he always adds Alexander's name so that he's always included and never forgotten. He feels that is his responsibility as the eldest brother. So please, I implore you to continue fighting for awareness, prevention, and ensuring that breakthroughs like these vaccinations are accessible to everyone, everywhere around the globe. No parent should ever miss the chance to watch their child grow up, and no sibling should have to visit a grave instead of singing happy birthday to their brother. By working together, we can make sure RSV becomes a thing of the past, sparing other families from the grief and long-term struggles that mine have endured. Thank you very much.
So, Rachel, I think your words obviously spoke for themselves. Thank you so much for sharing this incredibly poignant story and for your amazing investment in the wake of your own experiences, because you're really fighting hard that other lives will be saved. I can't express enough respect, and I think it's also echoed in the room, and I just want to thank you enormously for everything that you're doing. You are an educationalist, you're in the best position to generate and manage and fight for this change, so please carry on, and thank you. I think this has influenced this discussion and made it so absolutely acute, so poignant that this is the direction of travel we need to take. So thank you once again. We're now going to take a little moment to move into a panel discussion. So I would like to invite the panelists to come up here, and for the speakers that would like to stay here, that's absolutely fine, and we'll move into a panel discussion. Good. I think we're all settled. Are you okay? Broken chair. There's always something that happens. Okay, we'll kick off anyway and we'll sort out that broken chair for you. Good. A warm welcome to our panellists for a discussion on how we can build on the flu blueprint and move forward on more robust frameworks and target setting for COVID-19, RSV, and pneumococcal disease. And it's a pleasure to welcome our first panellist, who is Professor Marta Nunes, who is a director in the Centre of Excellence in Respiratory Pathogens in CERP in Lyon, France. She is a professor at the University Claude Bernard, Lyon. And Professor Nunes, we are absolutely delighted that you're with us today. As an expert on respiratory infections and reflecting on the flu framework, what are your thoughts on how the EU and member states could really move forward, improve surveillance and data collection, increase immunisation uptake, but also public awareness in a sort of nutshell? And we'll be posing similar questions to the other professors on the panel as well. Please.
Thank you so much, Nicole, and thank you so much for the invitation to be here. I'm really delighted to be here in this panel. And Rachel, thank you so much. It's not the first time that I hear your story, and it's really very, very touching. So I think it is an important reflection, and it is very important for us to hear these type of stories, because normally we think that the flu, RSV, is just a common cold that is not very, very severe. So let me just start with the influenza. So probably I have the easiest task of the panel here today, because we already have some success stories of influenza. And one big achievement was already mentioned here today, the 2009 Council for EU level achievement of coverage of 75% that really brought influenza to the table. And although we know that that target has not really been achieved by many countries. The average in many countries is still below 50%. It really was a big step, and to bring attention to the table, to really put influenza in the political and in the public health agenda. So having this type of targets for other respiratory infections, it's really, really important. And I think another big strength of influenza was already mentioned here today. It's the surveillance, the robust surveillance that we have in many EU countries. So we know that ECDC, WHO, together with the national influenza centers, really link different data sources from epidemiological, clinical, and vaccine effectiveness information. And if we can have those type of platforms for other infections, would be really, really important. So just very quickly, I think there are 4 important points from influenza that we can bring to other respiratory infections. One is that actually target matters, so having a set of a coverage ceiling or a coverage aspiration for vaccination coverage would be important. We already also mentioned surveillance and data, so to have good recording systems that can really give us robust information on the burden of respiratory diseases, that can link cases with vaccine effectiveness, and this is really also in line with the EU health space data space that is targeting towards that. We have not really talked today too much about real-world evidence and real-world data that is being acquired once the vaccines are rolled out and countries start collecting information on data. So we now know that real-world data that can be collected, that can be trusted, is very, very important. And then I think the last point that was already mentioned here today, that probably is really a key one, it's that data and numbers are not enough. We do need to have the healthcare workers, we need to have the public stakeholders from the beginning in this discussion. So really investing on education, investing on communication would be really important. Nicole, I had other points, but I think for the sake of time and to hear my other colleagues in the panel, I will stop here. Thank you so much.
Thank you very much, Marta. That's very gracious. A round of applause for those really important points. We'll now move on swiftly to Professor Dr. Leif Erik Sander, based at Charity in Berlin and head of personalized medicines in infectious disease programs in the Berlin Institute for Health. A warm welcome to you. A similar question as the one posed earlier. Given your extensive expertise in building on the achievements of the EU influenza policy framework, how can we really move forward on the critical issues that have been raised so many times this afternoon?
Well, thank you very much, first of all, for hosting this event and for inviting me. I think this is a critical issue, and I'd just like to start by reminding everyone of the enormous burden that the COVID-19 pandemic actually posed on across the EU, causing an estimated 1.6 million excess deaths between 2020 and 2023 alone. This can often be forgotten, and we heard the former Minister of Health in Ireland about the controversies around vaccination, and I think it's important to remember the massive burden. Yet this being said, luckily and thankfully, we've moved out of the public health emergency, and we are in a different state. Yet COVID is here to stay. It still causes a massive public health burden. If you look at Germany, there are modeling data suggests that just last year, COVID-19 caused something in the neighborhood of 25,000 deaths and around 200,000 hospitalizations. And this is just speaking of the acute burden, the direct burden, obviously not taking into account the economic burden, the indirect burden on workforce and all of that comes with it. So, and we've heard about the benefit of vaccination and the massive benefit of COVID vaccines, yet it translates into very, very poor uptake rates across Europe, specifically also in Germany. We have an uptake rate in the population that is eligible of about 19%. So this is clearly needs to be improved. And also, I think, and it has been mentioned before, it's also important to mention that COVID-19, just like the flu and just like other common respiratory viruses, has been associated with a significant increase in the risk of other chronic non-communicable diseases. Most well known is the increased risk for myocardial infarction, so a 2 to 4-fold increased risk of acute myocardial infarction. But our own research that we have conducted on larger data sets suggests that many common respiratory tract infections are associated with a number of chronic diseases, including cardiovascular disease, but also other diseases such as dementia that obviously cause a massive burden on healthcare systems and economies in the EU. So therefore, I think it is safe to say that the COVID vaccines are a very, very powerful yet vastly underutilized tool of prevention in the EU. And we can use this tool in a much better, a much more impactful way in lowering acute and chronic disease burden. So in light of these facts, I think it is about time that the EU implements a new harmonized framework for surveying and managing and preventing these diseases. And in order for such a harmonized strategy to work, I think it is important that we have a harmonized target. In order to sort of reach these targets, I think there are several things that we need to do. Just 3 brief things. The first one is we need better data. We need to be able to obtain interoperable and harmonized data on vaccine uptake as well as vaccine effectiveness. And these data need to come more quickly than they do right now, when we only see effectiveness of these vaccines with a bit of a delay. And secondly, I think it is important that we change the mindset. So COVID vaccines, moving from an emergency mindset, a one-off emergency fund-related campaign to this is a routine vaccination, something that is offered as a part of preventive care. And we also need to increase accessibility. And this has been mentioned also by the minister, that we need to utilize other avenues in order to reach the ones that need the vaccines. And this can be pharmacies, and this can be other professions. I think I'm a clinician in a hospital. We also have to think about, why don't we vaccinate our patients when they're in hospital? So these are things where we can really make better use of vaccines. And finally, last word, it's communication. We need to improve communication, and this communication needs to include these chronic diseases and the complications that we can avert. Thank you very much.
Thank you very much. That was a very clear playbook in a nutshell that really reiterated some of the messages we've heard earlier today as well. I'd like to now move to Professor Dr. Louis Bon from Wilhelmina Children's Hospital in the University Medical Centre Utrecht. I would love to pose a similar question to you. Based on your extensive expertise, how do you think we should move forward? And building on the excellent speeches, clear statements, clear evidence, what would you do if you were sitting here as a politician? Please.
Thank you very much. You heard earlier from Rachel, thank you again, that in 3 weeks her son would be 16. I'm used to tell stories. I don't think you need another story about RSV. This is what the disease is. So I will improvise, because she told you what the disease is. And I will add some numbers to this disease, and I will try to integrate that into a picture that we try to give you here, that we don't need to protect against the disease, but many infections of the respiratory tract to get better health for our citizens. So 94% of disease was prevented in Ireland, we heard. But what does 94% mean? 1 in 56 healthy children in Europe will be hospitalized for RSV infection, 1 in 56. So if you want to remember one number for RSV, it's 1 in 56. 1 in thousands of all children in our community will be requiring mechanical ventilation to survive. And then still, a few of them will not make it, like you heard. It is one of the most common diseases in the world, and it is the second cause of death in the world following malaria during infancy. So it is a highly frequent disease. And we have good measures to prevent it that have only been started only a few years ago. For babies, it's very clear we need to immunize all babies in the first year of life. We need to protect them, and not just high-risk babies, but all of them. For the elderly, it's a bit different. The elderly have a high risk of severe disease if they have comorbidities or if they are over 75. So what is the burden in elderly? To give you a flavor, it's about the same as influenza, but much less is known. So I completely support the idea of Rachel. We need better education. You ask, what do we need? We need good surveillance, education. Please have a look at the chatbot. It is an educational tool that is available in every language that we have ever heard of. And what we need is independent support from politicians to get better education for the public and the healthcare workers to get better trust in our vaccine policy. Thank you very much.
Thank you very much, Louis, also for building so nicely on Rachel's powerful words. Thank you for that. We're now going to our final panellist, who is Anna van Rennen, who is Research and Policy Officer at the International Longevity Centre in the UK, and your work focuses particularly on inequalities and disparities. A warm welcome to you, Anna. As a researcher focusing very much on improved health outcomes for older adults, what insights have emerged from your work that could be fed into this idea of advancing policy significantly at EU and member state level in this space? The floor is yours. Thank you.
Thank you so much, Nicola, and thank you so much to the steering group for having me here today. So I'm just going to touch on a recent project that I've done, which is a pneumococcal atlas, which tracks vaccination coverage, recommendations, and funding across 42 European countries. And the results aren't really that surprising, probably. So we found that infants have a very high rate of vaccine coverage. The coverage sits at about 89%. But when we get to at-risk groups and older adults, we can see this really stark gap between sort of what we're seeing in infants and what we're seeing in these groups. So at-risk groups have a coverage of 27% only, and older adults have a coverage of 32%. So sort of insights from that research are really telling us that we need more equity across the life course when it comes to immunisation. What we also need, though, is better data, because although I've just rattled these numbers off to you, they're based on a very small group of countries that actually do report data. So only 15 countries out of 42 report coverage for older adults. So for EU and member states, what we really need is better data. Otherwise, we're basically driving blind. And we also need actual targets. Similar to the flu targets of 75%, we need a target of 75% for pneumococcal, for RSV, and for COVID. I'll also echo what my fellow panelists have said about empowering healthcare professionals to really administer vaccines and be that voice for education as well. And the final thing I'll say is equity in access. So that means making sure that marginalized groups are also getting vaccinated, that older adults are also getting vaccinated, and that access is easy for everyone, no matter who you are.
Thank you very much, Anna, also for reiterating this piece on equity and inclusion. I know that is a big piece of your mission, your personal mission. That was great to hear that echoed. We're now going to have a little bit of an involvement of the participants. We have a statement from the European Health Management Association, which I won't read out in full. We'll include this in the report that comes after today's meeting. But effectively, the European Health Management Association is fully aligned with the work of the steering group. They feel that effective prevention depends on effective management, health management, on systems that connect data, coordination and leadership to protect EU health and EU populations. That, in a nutshell, is the message that they wanted to convey. The devil is in the detail. They've done some very interesting research as well, and we'll include that in the report that you'll get at the end of this meeting. I would also now like to invite other contributors. I think we have Emily Karafilikas in the room. Hi, Emily. Good to see you. You are the director, European Director of Vaccine Confidence Project. Increasing immunisation targets depends not only on access and supply, but also public trust. And this has come up in the conversation today already. Very, very briefly, because of time, can you please look at how you, from your seat, address this in the work that you're achieving?
Sure. Thank you. I just want to start by saying that, you know, when I started working in this field 12 years ago, vaccine confidence and public trust was this tiny little reflection at the end of meetings like this. And now, today, I'm so happy to see that this came up in almost all of the presenters and speakers' discussions. So that's really a great improvement. But I just want to make one remark, which is, I think a lot of the times it's very easy, and unfortunately this is what we're seeing in many places, to blame everything that we're seeing, drops in coverage, drops in trust, on misinformation. And so I just want to say one word of caution, that this is not only about misinformation, it's about a lot more. And recently I came back from maternity leave about 3 weeks ago, and I was part of a mums group that was discussing, plenty of things, but vaccination was one of them. And what we were seeing in that group, it wasn't spread of misinformation, it was emotions. Mothers being afraid of what could happen to their babies, mothers sharing anger and not being listened to by their doctors, by others, mothers hoping for prevention and better care for their children. And I think if we stop seeing this and seeing the emotions behind vaccination, we're not gonna make it. So if there's one call that I'd like to make, is to really think about how all of us can think about using that and responding to that, listening to people, respecting their thoughts and their concerns, and integrating that in our work. Thank you.
Fantastic. Thank you very much. And that links very nicely with some of the words we heard from Stephen in terms of listening deeply to people. Another patient's perspective, I'd like to invite Fraser Goodwin, who's the policy coordinator of the European Federation for Allergies and Airways Diseases, quite a mouthful, to give a little bit of insight, and very, very briefly, please, Fraser, on the experience of vaccination for people with chronic respiratory diseases who are particularly vulnerable. Again, a couple of sentences to give us the idea.
Thanks, Nicola. Yeah, I think one of the things that I'd like to stress is to underscore the point that Stephen made about how important it is that vaccines are effectively rolled out, that access is very, very easy to gain. And patients with chronic respiratory disease obviously face additional threats, and it's not only cardiovascular patients that require priority access to vaccines. The problem is that the experience of our patients in our community is currently rather a patchwork of experiences rather than something that is universally good experiences. A little side note, my wife is an asthma sufferer. She's also recovering from breast cancer, so she's particularly important that she has early vaccination, even in this country where it's rolled out through pharmacies. It should be easy. Finance is not a barrier to her, yet she still had obstacles and difficulties in getting her vaccine. So I think my big point to you is it's not, we're willing to be the strong voice, the patient advocates that supports vaccines, that fights vaccine hesitancy, misinformation, disinformation, but we also, to make that experience work for everybody, it needs to be effective, it needs to be accessible and easy. It's much harder now to put in the resources necessary for routine vaccination than it was for stepping up to the crisis that was COVID. We need to remember the lessons of that period and put in the same sort of efforts we did for fighting the pandemic as we do for the prevention of diseases that seasonal vaccines offer.
Fantastic. Thank you very much, Fraser, for that additional insight from the perspective of people who are particularly vulnerable living with some chronic conditions. I'm going to close this, and I hope that all of the panellists will cooperate with me. I just want one sentence from each of you, one sentence from everybody, just to close, just in terms of your key takeaway. And I'm sorry, I'm going to kick off with you, Hannah. One sentence.
That's okay. My one sentence would be, we need better data collection and disaggregated data to really improve outcomes.
Thank you. Rachel.
I'm going to reiterate my earlier point, which is education, so that people understand what the vaccinations are actually for, and to prevent RSV.
Great, thank you. Live Eric.
I think we need awareness. It goes along with education, but we need awareness of patients, yes, the public, but also policymakers in understanding the incredible value that vaccines offer in lowering, the burden of disease and utilizing that, and that, that was mentioned in the report, that the investment really comes back at a very high rate. So this would be my statement. We need awareness for this, and then the action.
Thank you. Colin.
It's imperative that we make every interaction count, and that is between us and policymakers, that is between us and patients, and that is to ensure that everyone is aware of the risks that these diseases pose and the benefits associated with vaccination.
Thank you, Colin. Stephen.
I would encourage an analysis for each of the 27 member states in terms of where the strengths and the bottlenecks are, because they will be different country by country, so that the interventions can be targeted. And, still one sentence, and I believe the EU, as a matter of urgency, should accelerate regulation of the 3 companies that own the 4 social media platforms that not only disseminate misinformation that costs lives, but now actively target and promote that information. And the EU is moving, but I would love to see the EU move as fast as possible to apply the rules that every other broadcaster has to live by to the social media platforms.
Thank you. That's a really important additional point. Excellent. Louis.
So, for a politician advocating to listen, you talk a lot. And I think this is my point, that probably, like Emily was saying, our call to action should be listening to the real concerns of society.
Thank you, Louis. And Marta, last but absolutely not least.
Sure, and I think everything was being said already, so it's very hard to bring something new, but here in my role of a scientist, of a public health advocate, so I really think it would be good for science, politicians, and to talk together and really developing these frameworks together. I think someone really mentioned earlier to have a coalition of different stakeholders with common aims, and I think we should plan for that, to really have different know-hows, different stakeholders at the same table with a common aim.
Fantastic, and that is really part of what this stakeholder group is all about in its essence. So this brings us to the end of a very insightful and thoughtful meeting, and the message is clear. The path towards robust EU preparedness and resilience requires a comprehensive framework for respiratory immunisation. We need a harmonised EU coverage target, we need strengthened surveillance, we need further investment in tackling misinformation, and we need an integrated approach to immunisation and inclusion in all EU health and resilience strategies, including, for example, cardiovascular health, which came up earlier. But most of all, I think we need you. We need trusted partnerships. Only together can we foster the political will to act, and now is clearly the time. A heartfelt thanks to all of our speakers and our panellists for joining us today. You, as the audience, our host MEP, Keller, and his great team, and of course all of you who've been participating online. We invite policymakers to endorse the steering group manifesto, which is launched today on the website, and we encourage all of you to socialise it, to disseminate it, and to really engage. The hashtag is EU Respi Day, and please show that a little bit of love on social media as well. That will be really, really helpful. Thank you so much, and we hope to see you all next year at the next EU Respi Day, where hopefully we can assess together where we are and the impact of our manifesto. So safe travels to everybody, and thank you all once again for coming.